and wondering what are the board's thoughts about how to address, the issues that have been raised, over the course of the 18, months that we've been meeting. Has the board met about or talked about actually, I guess the question is, has the board received a briefing from the chair of the work group about the findings of the work group?
Yes, the final report.
I guess I could be asking the chair, have you had an opportunity to report out to the work group, the full, all the findings? I can't hear you.
I wasn't talking, I think Ms. Richards. No, not as yet, that I have not. And that's something we can work on once this meeting is over. So yeah, and we can discuss that and then bring up other topics. So yes, definitely we can do that.
Yeah, because and again, I'm sorry I was late, but coming on, just sort of, it seems like we're stuck in justifying, the legislation. I mean, the status quo, and the purpose of this work group is to really take a holistic look at the challenges that the occupation itself is facing. Has the board considered temporary licensure itself, or talked about how to do that, to deal with that process?
Basically what?
Has that been an agenda item? I guess
I think Karen is frozen, but we have talked about it before in terms of COVID when people couldn't.
Recently discussed.
Karen, can you hear me?
It's not been an exit.
We can't hear you. But it's been in the legislature before, and we have talked about it, especially in terms of COVID, but that hasn't come up lately in my mind.
And I guess my final question, because I know I'm just taking up a lot, what is the sort of policy agenda of the Board of Examiners, for this upcoming year? Again, this board ends, maybe we'll have another opportunity or so, but, this work group in this current form ceases to exist at the end of June. So I think it would be probably very satisfying, or would help inform future actions and collaborations to understand, what are the big issues that the board is undertaking on behalf of social workers and social work practice in Maryland.
My apologies. Can you hear me now?
Okay. Yeah.
So I will tell you, now that we're fully staffed, our hope is to do a lot more outreach to the schools. We've already collaborated with the University of Maryland School of Social Work, the Student Engagement Office. They had some scholarships that and several applicants to pay for the application fee. And our
I'm sorry. I don't want to. I'm sorry. The work of the Board of Social Work isn't. I think it's clear. There's a lot.
Okay. I'm not sure what
my interest in hearing I think we all know the position on the board, but I am just curious about, there have been a number of issues raised, both administrative as well as just a actual practice and, providing support for not only students, but for social workers, and just wondering what is on the agenda for the Board of Social Works. For example, we hear a lot from the other health occupations. Like, we hear from their boards all the time about what they need, and not as much time, you know, on the, you know, I gotcha component, but the, you know, sort of broader. So it's just, you know, just wondering what those broader issues are that the board of social work examiners will be pushing forward on behalf of the field itself.
I think we had our recommendations, you know, in terms of ways to reduce barriers and increase passage rates. I think the board will continue to look at that and see what can be done. We are willing to work with others, meet with other stakeholders to see what we could do. So yeah, we want nothing more than there to be more licensed social workers in Maryland, competent licensed social workers in Maryland. We understand the behavioral health shortage. I think that, you know, administratively, we were addressing in the last year staff shortages, addressing the delays in processing applications. We've worked on that. You know, we have the social work compact that legislation will pass on October 1st, and the board will be active and working with the commission to try to get that up and going as soon as possible so Maryland social workers can join that compact. So yeah, we have a lot on the horizon. I
guess I say, so in the issues of continuing education, current regulatory compliances, impacts of new federal guidelines, reduction in budget allocations for social work or reimbursement by insurance companies for the practice. None of that is on the board's agenda. Just asking.
I'm not prepared to answer, but I'm certainly, I will take notes and we'll bring it to the executive committee.
Okay, great. Again, thank you, Madam Chair, and I appreciate the committee allowing me this opportunity to